The disability element of the ABCDE assessment is essentially a neurological assessment. It's possible in the OSCE exam that the patient may be confused, but unless you are dealing with a subdural scenario, you do not need to use the Glasgow Coma Scale (GCS) for them. The NEWS2 chart is fine. On the NEWS2 chart, you will be asked to assess the patient on the AVPU scale and make a decision on whether or not the patient is alert, confused, responsive to voice or pain, or unconscious. If the patient scores less than A on the AVPU scale, you must perform a GCS. It is best practice to take a structured approach to AVPU as if you would if you were doing a more formal GCS observation. To assess if the patient is alert or confused, consider if the patient opened their eyes spontaneously when you entered the room. Ask the patient orienting questions about where they are, and ask them to follow simple instructions to see if they can coordinate their cognitive and physical movement. You should note if they are responsive to verbal stimulus, or whether you need to apply pressure in order to assess if they are responsive to pain or are unconscious. You should verbalize this, as you have done with your other observations.
Do you know where you are today?
Yes, I'm in the hospital.
And do you know what day is this?
It's Tuesday the 4th of August.
Okay, that's right. And can you please stick out your tongue for me? Alright, and can you raise your eyebrows, please? Thank you.
Eye pupil
And
size is also an
I may need you
indicator
to
of
put your
disability.
arms forward, and
When
can you
measuring the
squeeze my
patient's
hands?
eye reaction,
Alright, thank you.
first ask if they are
Alright,
wearing
so I can
contact
say that
lenses,
Mana is
and
alert,
also
conscious, and
if they have
coherent.
ever had eye
And
surgery.
I'll put an alert on the AVPU, and I may not need to do a GCS assessment.
Eye pupil size is also an indicator of disability. When measuring the patient's eye reaction, first ask if they are wearing contact lenses and also if they have ever had eye surgery.
Now I will go on with my exam, and I would like to do a quick eye assessment with you, if that's okay.
Yes, that's fine.
Before I do so, can I just confirm with you if you have any contact lenses or had any eye surgery?
No.
Okay, so what I want you to do is that you look straight into my nose while I shine this torch from outer eye to inner eye. Is that okay?
Okay.
So we'll start with your right one first.
Okay.
Shade the patient's eyes against external light with your hands and then flash the pen light into their eyes from the side in order to not confuse the patient's response with the accommodation reflex, which is when the size of their pupil changes according to how near or far an object is. The pupils should be of equal sizes and should immediately get smaller with light and immediately dilate when the light is withdrawn. Normal pupils should be about 2 mm to 5 mm across. You would expect a direct and consensual reflex in the patient's opposite eye during this test.
I can see that both pupils are equally reactive to light. The size of both pupils is 3.
Signs of disability could be caused by a number of reasons, including hypoxia, cerebral hyperfusion, sedatives, analgesic drugs, hypo or hyperglycemia, recreational drugs, and alcohol. One of the most common causes for confusion is low blood sugar, which is why monitoring the patient's blood glucose is an important part of your disability assessment. When monitoring the patient's blood sugar, first tell them what you're going to do in order to gain consent. Before starting, ensure you have all the equipment you will need, including the alcohol swab wipe, lancet, test strip, glucose monitor, cotton wool ball, gloves, access to a sharp spin, and a plaster band-aid if needed. Don the gloves, and if it's easy for the patient to wash their hands with soap and water, then you can ask them to do that. However, commonly, if they are in a hospital bed, an alcohol swab wipe is most commonly used. Remove the items from their packaging and insert the test strip into the blood glucose monitor. Turn the machine on and verbalize that the machine has been calibrated and is ready for use. Different institutions have different types of machine, so ensure you are familiar with the one at your test center prior to starting the exam. Ask the patient if they have a preference on the finger that you use for the test, and then push the lancet flush up against the skin and press it. As soon as the blood droplet pools, dip the end of your test strip into the blood droplet and wait for the monitor to produce a reading. It can be helpful to know what the patient's normal blood glucose level is in order to make an assessment of whether their blood glucose level is normal for them. For the majority of healthy individuals, normal blood sugar levels are between 4.0 to 5.4 millimoles per litre, 72 to 99 milligrams per deciliter when fasting, and up to 7.8 millimoles per litre, 140 milligrams per deciliter, megagrams. For the majority of healthy individuals, normal blood sugar levels are between 4.0 to 5.4 millimoles per litre, 72 to 99 milliliters per deciliter when fasting, and up to 7.8 millimoles per litre, 140 milligrams per deciliter 2 hours after eating. If the patient is identified as having low blood sugar, then depending on their severity, you may need to treat them with glucogen. After taking the reading, pass the patient the cotton wool ball to compress their prick and stop it bleeding further. You should then promptly dispose of the gloves and blood test strip in the clinical waste bin. Dispose of the lancet in the sharps bin. Don't forget to perform your hand hygiene and record the patient's capillary blood glucose level. The blood glucose level is recorded at the bottom of the News 2 chart. You can find it underneath the News 2 total and the patient's pain score. The blood glucose monitor should be cleaned as part of the other equipment after you have completed the station. To complete your disability assessment, you may want to ask the patient about their pain score, if they've experienced any nausea or vomiting, when it was the last time that they ate, and when it was the last time that they passed urine. If the patient has a catheter inserted, you should be able to monitor their urine output via their fluid balance chart. If the patient is demonstrating symptoms of disability, you may want to review their drug chart for any reversible causes.